Hello everyone, I'm Dr. Tefia Devi. I'm a consultant psychiatrist and a psychologist. I do videos on mental health and personal improvement education. My goal is to help demystify mental illness and provide you with self-help tips that will help you be your best and live your best. On today's video, which is part of the Childhood Experience series, I will be talking about mood disorders in children and in adolescents. The mood simply refers to a transient emotional state that is responsible for how we think and how we feel. Now, that transient emotional state is also responsible for how we respond in terms of our thoughts and our feelings to the external environment. When we therefore talk about a mood disorder simply refers to a distortion of that transient emotional state. That distortion therefore leads to some level of dysfunctionality, therefore leads to some level of distress for either the individual or the people around them. That distortion is also some level of a deviation from the normal that is expected in society or even for that individual in particular. And that distortion sometimes can be very dangerous. So we're going to talk about mood disorders in children and adolescents. Now, there are several types of mood disorders that are quite common, and mood disorders are fairly common among adolescents, and I will talk about why that is. But in this particular video, I would like to focus on two mood disorders, and then in another video I will talk about another mood disorder. So in this particular video, I will be talking about the mood disorder called unipolar depression, and also I will talk about bipolar disorder in children and adolescents. In another video, I extensively talked about the signs and the symptoms seen in unipolar depression, but my focus was in adults. And in this particular video, let's talk about some of the peculiarities of unipolar depression in children and in adolescents. Now, the battle period, the period of puberty, is a very peculiar period because in that period, a lot of things are happening. There are biological changes, there are social changes, there are psychological changes going on all at the same time. Biological, there's quick maturation in terms of physical development. Psychological, there is literally a change in terms of cognitive capacity of that child. And then socially, there are changes. There are different types of changes going on. It could be change in school, change in peer relationship, change in family relationship. So there are a lot of things going on about that time. And so it's not uncommon for children in the period of adolescence to actually experience some level of depression. And quite commonly is the coexistence. In fact, in about 40 to 90% of cases of children having unipolar depression, you also have coexisting other mental health issues such as attention deficit disorder, such as substance use and anxiety. Just like in adults, girls are said to be more likely, twice as likely to have unipolar depression compared to their male counterparts. This probably is because of some hormonal changes and the fact that these hormonal changes make the girls more sensitive to stressors. Not that these hormonal changes in themselves causes depression, but they are just more sensitive to depression. So girls are more likely to have depression or be diagnosed with depression at this age. The biggest risk factor for having depression really at this age is a family history of depression. That is the biggest risk factor. Even though there are a lot of changes occurring, social changes, psychological changes, biological changes, the biggest risk factor for having depression in this age group is still a family history of depression. So how do you identify depression, unipolar depression, as I said, in adolescents or in children? Here are some tips. You can look out for low mood, being unhappy, being sad, and sometimes a bit difficult to actually take note of these things, because children and adolescents tend to conceal this from their parents. So many times parents may not even notice they are sad. But this is something you may notice. You may notice that the child becomes withdrawn and would not want to always hang around other members of the family. That can be an indicator of them, being depressed. Or you may notice being very strongly irritable, snapping, being really upset with siblings, with others, just going into an outrage, or snapping a lot. That also may be an indicator of depression. One thing too that you may notice is a change in sleep patterns. So sleep patterns can become really all everywhere and just scattered. It could be excessive sleep, it could be too little sleep, but that also may be suggestive. And then there is weight loss. In adolescents, sometimes you may have weight gain, but more often than not, you have significant weight loss that occurs with adolescents. And then you may have a drop in academic performance. That also is strongly suggestive of depression. Now, these symptoms are not necessarily in themselves just standing alone diagnostic for depression, but they are things that you really need to look out for. And then a low self-esteem, a very strong low self-esteem, sense of guilt, sense of inferiority complex, and all that, very low self-worth. These are signs and symptoms that may strongly suggest that the child may be struggling with depression. Now, if you observe any of these things, my advice would be that you go seek professional help, have a conversation with your child, but also go seek professional help. Let's talk about bipolar disorder. So bipolar disorder is like the other, another form of a mood disorder. Now, 60% of cases, more than 60% of cases of bipolar disorder will normally occur before the age of 18. That's the first episode, will normally occur before the age of 18. And there is a strong family connection. What I mean by that is that there's a strong genetic component responsible for this occurrence. So many people, about 60% of people or more that have bipolar disorder have a family member, either a first degree family, that's an immediate family, or an extended family member that has had a similar condition. So, and more often than not, 70 to 100% of people will improve, will get better. Usually the first episode is not usually very severe, may last just for a few days, and sometimes resolve spontaneously, sometimes even without any form of intervention. There is complete resolution. But the catch is that many people, about 80% or more of people following the first episode and the resolution, they tend to have a second episode and may go on to have subsequent episodes, especially between 2 to 5 years after they have been symptom-free for a while. Now, having said that, how do you recognize bipolar? I also have another video that I focused on the symptoms of bipolar. You could watch that video, and it's a bit more expansive on the symptoms to look out for in bipolar. One thing that is worthy of note is that for children and adolescents experiencing this condition, unlike adults that it's quite clear and quite obvious, there is a lot of gray lines in terms of stability. So there's a lot of mixed picture of anxiety, of depression, of excitement in adolescents coming up with bipolar. So it's not very classical. It doesn't look so classical like you see in adults. That's something that is worthy of note. Having said all of that, there are some features that are strongly suggestive of a poorer outcome. And one principal feature is the presence of psychosis. So psychosis basically talks about the presence of delusions, the presence of hallucinations, and the presence of a disorganized behavior. So delusions are basically strongly held beliefs, against contrary evidence. Hallucination is to experience in any of the five senses without an external stimuli. That's what it basically is. So having said that, like I said, go look out for the video on bipolar. They're quite similar, but with adolescents, it's really more unstable. The presentation is more unstable and more mixed. I hope this has been helpful. Just in case you've not subscribed already to our YouTube channel, kindly do that. That way you don't get to miss out on any of our subsequent videos. Thank you very much.